Hi, my name is Emily Dale and I'm a certified veterinary technician at Angell Animal Medical Center of Boston, Massachusetts. Today I'm going to show you how to administer food through a feeding tube with my friend Pooh Berry here. The prescribing veterinarian will indicate the type of food, the rate, and the frequency at which you're going to feed your friend. The consistency of the food will play a big part in how easy it will be to administer the food in the feeding tube. So make sure to use a food blender or a processor to get the food nice and smooth. The temperature is also very important. Make sure that it's body temperature, warm to touch. You can use a microwave for a few seconds or run it under hot water under the tap to make sure that it's nice and warm. Think of the temperature you'd want to feed a bottle to a baby. So I'm ready to administer food to Pooh Berry through her feeding tube now. If you're at home doing this, finding a good spot on a table where you have good control of your animal, or even on the floor where you're cuddling in their bed or on the couch, someplace that you're going to be comfortable for about a half an hour or so, since this is going to be taking a little bit of time. So I'm going to start with the water flush. This should be the amount indicated by your doctor. Right now I'm using 5 milliliters of water. It's warm to the touch. And what I'm going to do is open up Pooh Berry's feeding tube. And I'm going to screw on the water syringe, very simple. And we're going to slowly push down the water. It's going to go down the tube without any resistance, nice and slowly. Okay, so I'm done flushing her feeding tube. I'm going to take off the empty syringe and I'm going to attach the syringe with the warm food. So same technique, you're going to screw that onto the port and then you're going to slowly start to put some pressure on the plunger. Now this might take anywhere from 10 to 30 minutes. It's all dependent on what your doctor has prescribed you to do. So like I said before, finding a comfortable spot is when this is going to be important. So I finished feeding her. And now I'm going to take off the empty food syringe and again attach some more water. So we're going to flush all this food down the tube. So that goes on just like the other two syringes. And you're going to push about the same rate very slowly so everything gets flushed down. So we finished feeding her and we finished flushing the tube. So the important last piece here is to make sure that you close the tube back up with the existing cap here. And she's all set. Some feeding tubes like Pooh Berry's are left in for weeks to even months. So proper monitoring of the insertion site is really important. Your doctor will provide you with detailed instructions on how frequently to do this. If you notice any redness, swelling, or discharge, call your doctor immediately. In order to prevent clogs from happening in the tube, make sure not to put any pills or tablets down. If you can find any kind of solution medication, or ask your doctor if there is an existing one out there. And you can always just put it right down the tube, just like you did with your food. If you notice any resistance while you're flushing the initial syringe of water, you can try using a little bit of cola. About 5 to 10 mils should do the trick. You can just put it through the tube, let it sit for about 10 minutes, and then flush it with about 5 mils of water. The carbonation and the acidity of the soda will help break up any food that has clogged up the tube. Thank you for watching this video about administering food with a feeding tube. If you have any questions or want more information, feel free to visit our website at www.angell.org.